video was created for nurses and other healthcare professionals who would like to increase their knowledge and cultural sensitivity of clients of Japanese descent in order to provide the best care possible to them. In this video, you will hear from Tomoko Unga, a first-generation Japanese American who immigrated to the United States in 1997, and Laura Kato, a fourth-generation Japanese American. Japan is situated in northeastern Asia between the North Pacific and the Sea of Japan. The area of Japan is slightly smaller than California, and it consists of 4 major islands, surrounded by more than 4,000 smaller islands.
Japanese is the official language spoken in Japan. However, many Japanese are able to understand English to a certain extent, since English is the foreign language that everyone must learn as part of compulsory education. Many Japanese people value communication that is implicit, nonverbal, and intuitive, rather than explicit, verbal, and rational. Therefore, communication may be seen by outsiders as less direct, somewhat vague, and concealing. A talkative person is often considered insincere or showing off, because there is an underlying assumption that when true caring communication is happening, there is little need for words.
There are currently about 1.2 million Japanese Americans in this country. Each year, about 7,000 new Japanese immigrants enter United States ports. According to the 2000 census, the largest Japanese American communities were in California, Hawaii, Washington, New York, and Illinois. The general structure of the Japanese family is vertical, with the father and other male members in the topmost position. Filial piety, or respect for parents and ancestors, is valued greatly in this culture. Family is central in the lives of most Japanese Americans, and contact with other family members occur frequently. Traditionally, the Japanese culture values collectivism and harmony, and considers the needs of the whole above those of the individual. Japanese American culture places great value on education. Across generations, children are instilled with a strong desire to enter the rigors of higher education, and a large majority of Japanese Americans obtain post-secondary degrees. Japanese Americans practice a wide range of religions, including Shintoism, Buddhism, and Christianity. It is a common saying that Japanese are born Shinto but die Buddhist. In Shintoism, the emphasis is on purity and cleanliness. Terminal illnesses and death are considered negative or impure. However, at some point, most Japanese are said to embrace Buddhism, which sees death as a natural process. Conversion to Christianity or other religions would certainly have some impact on views of death, dying, and end-of-life issues.
Similar to our food guide pyramid, this is a graphic representation of the food guide spinning top from the Japanese Ministry of Health, Labor, and Welfare. A typical Japanese diet includes rice with nearly every meal, vegetables, seafood, pickled foods, soy sauce, and green tea.
We eat lots of rice, and I have to have rice. And also we eat lots of vegetables, lots of fruits, and seafood is good. And we eat a little bit meat, chicken, beef, and pork. We don't eat so much meat like here in the States.
As it relates to healthcare, what are some cultural beliefs among Japanese?
Gaman, which means to endure or to bear, may lead many Japanese people to refrain from expressing feeling of pain. Stoicism and control of emotion are valued and often learned at a very young age.
As far as the pain, I try not to express my pain too much, because that's how I was raised. I was raised to endure pain inside, not to show the pain, not to cry. So that's how I express my pain. And I think my parents and other people in the same way too. If you show like a pain, people might think you're like immature. It's not appropriate. So people try not to show pain too much.
A patient's response to pain may depend on how closely they identified with traditional Japanese values. As you can see in this video, younger generations may not believe in gaman.
And when I'm sick, usually I try to, like if I have a headache or something, I'll try and just sleep or drink water or not take a lot of medication, just because, hopefully there are like other ways that can prevent that pain. But then if I have anything that I think it could be something alarming, I'll go to the doctor or, schedule something.
Caregiving is referred to as 当たり前のこと or matter of course. Caregiving is seen as natural things to do that can be handled by the family. Since the family system is patriarchal, caregiving is usually provided by the wife, daughter, or daughter-in-law.
Japan's healthcare system is unlike our managed care model. In Japan, patients do not need appointments and can usually be seen on the same day.
Because in Japan, we can see doctors whenever we have problems. But here, I feel frustrated because I have to make appointment to see doctor. I have to wait a couple weeks for a month.
In Japan, healthcare professionals are seen as experts. Japanese American clients may wait silently rather than ask questions because they believe healthcare providers know best and will meet their needs without being asked. Elders may defer decision-making totally to their children, often to their oldest son. Serious diagnoses are often discussed with the family first, and they may decide how, when, and if the diagnosis will be shared with the patient. Open discussion on dying and death may be difficult depending on the degree to which a person or his family maintains traditional culture. Care should be taken when assigning a patient to a room, and the numbers 4 and 9 should be avoided as these signify death and suffering. Many of the diseases that Japanese Americans are at risk for have been linked to the adoption of a Western diet and lifestyle. One disease that has a higher prevalence among Japanese Americans than their counterparts in Japan is type 2 diabetes. This occurrence has been linked to a high-fat diet and a lifestyle low in physical activity. The Japanese American population tends to have high rates of stomach, colon, rectum, and liver cancers. These cancers are believed to be linked to the culture's diet, which typically includes many salt-cured foods, pickled foods, and nitrates. In the past few years, Japanese Americans have also experienced an increased incidence in breast and prostate cancer.
Historically, Japanese Americans have been found to have much lower risk of heart and cardiovascular disease than their white American counterparts. But with increasing adaptation to the Western diet, there appears to be an increase in coronary artery disease and evidence of higher risk of hemorrhagic stroke among Japanese American men compared to Caucasian men. The prevalence of vascular dementia among Japanese American men appears to be higher than Caucasian men, and the prevalence of Alzheimer's disease appears to be similar to Caucasian men but higher than in Japan. The frequency of undiagnosed dementia may be common due to the reluctance to report alterations in mental status. It is important to educate clients about diseases common among Japanese Americans, with an emphasis on preventative health care measures. To provide culturally appropriate and competent care, the nurse must engage the support of other family members. The nurse should be aware that family members will often bring comfort food to the patients, and should educate the client and family on the importance of limiting use of soy sauce, salt-cured foods, and pickles.
I think a big thing is like when you're in the hospital or something and you're dependent on meals and stuff and you're just kind of like lying in bed. So like food was a big thing for him, especially like, his comfort food is like rice, which may not be the same as like another American, right? But because of his Japanese background, he kind of craved those types of foods.
The purpose of this video was to illustrate some differences between Japanese and American cultures. Use this information to guide you, but remember that the nurse must assess the unique needs of each individual and the extent to which the information presented applies to that person or family. The importance of establishing a trusting relationship based on the respect and open communication with the client and the family cannot be underestimated.